Do you have pain on the outside of your hip? Perhaps you find walking up or down stairs difficult or crossing your legs uncomfortable.
Well, at the end of this video, you're going to know why you have pain and what you can do about it.
If you have pain on the outside of your hip, you might have been diagnosed with hip bursitis and or a gluteal tendinopathy. However, there are a lot of structures in your hip, and it's very difficult to identify one specific structure as the cause of your symptoms. For this reason, Greater Trochanteric Pain Syndrome, or GTPS, is the term used to describe pain in this area. But put simply, we're going to call it lateral hip pain.
It's important to remember that pain is very complex, and the anatomical structures are just one small part of the story. Studies of MRI findings show that things like gluteus medius tendinopathy, osteoarthritis, and hip bursitis are common in people both with and without pain. Hip bursitis in particular is frequently seen in people with no symptoms whatsoever. Let's take a look at some other factors that might be contributing to your pain.
Firstly, let's have a look at why women are more susceptible to this condition. One potential reason is that women have wider hips, which can result in a greater Q angle, which you can see in this image. This places greater compressive stress on the outside of your hip, which is why women are more susceptible to lateral hip pain.
Another cause of lateral hip pain is a big spike in the load that you're putting through your hips. This is what we sometimes refer to as too much, too soon. And a classic example would be going from walking 2 kilometers on flat ground each day to all of a sudden going to massive 4 or 5K walks up in the bush over hilly, rugged terrain. This is simply just more load than your hip is accustomed to, and it can become very sensitive as a result. So if you've experienced lateral hip pain, think about what factors might have increased the amount of load that you're putting through your hip. Okay, let's talk about what you can do to reduce your lateral hip pain. The first step is load management. This is about reducing what you're doing so that your hip can handle it. If we look at that walking example, you might reduce the time or the distance that you're walking, the speed of your walking, and take out some of the stairs and hills that place a lot of load on the structures on the outside of your hip. If we think about strength training, you might try reducing the weight that you're using with the exercises, the range of motion, or you might try different exercises altogether to find something that you can tolerate. But it's important to keep some level of activity going.
You can also minimize time spent in aggravating positions. So things like sitting with your legs crossed or lying on your side. Some people actually find sleeping with a pillow between their legs helpful in reducing pain. Now, once your symptoms have settled, you can slowly increase your activity levels by very small increases. So say, for example, you were walking for 10 minutes and you tolerated that really well. Don't jump straight to a half an hour walk. First of all, try a 15-minute walk and see how you cope with that. So there's some principles to guide your recovery. Now let's have a look at 4 exercises to help build hip strength.
Okay, exercise number 1 is one that I often give to people who have really particularly sensitive lateral hips, and it's the glute bridge. Now the glute bridge is great because it requires quite a small range of motion, which makes it quite easy to perform, and it also doesn't require a massive amount of load like something like a squat. So for the glute bridge, you're going to lie on your back on the floor, hopefully on a softer surface, or maybe on your bed. And with your hands flat by your sides, and of course you can rest your head back, knees bent at about 90 degrees, you're simply lifting up your hips as high as you can manage before slowly lowering your bottom back to the floor, just like this. And try to be nice and controlled. And what you'll feel is these big muscles in the back of your bottom, your glutes, and also the muscles on the side of your hip working to lift your pelvis up into the air. And usually this one is a great starting point, even if you have really sensitive hips. It's a great way to start getting some load through that area. But if it's too easy for you, let's say you're easily handling 15 repetitions and you could feel like you could do it all day, here's a way to make it harder. At the top of the movement, you're going to add a hold for 5 to 10 seconds, and you'll start to feel some fatigue in those glute muscles, and then you'll slowly lower back down. And once again, you could do 10 to 15 repetition of 5 to 10 second holds. Now, if that's even still too easy, you can take it up another level. So in that holding position, I'm going to add some marching. So slowly lifting 1 foot up at a time. And you don't need me to explain this to you if you give it a go, but you'll feel straight away one side is having to work a lot harder. And that's a great way to practice getting your hips to tolerate the load that you put it through in daily life. So that's one, the glute bridge.
Okay, so let's look at our second exercise, the tempo squat. Now, when I say tempo, I mean we're playing around with the speed of the movement, and in this case, we're slowing it down because often the squat can be an aggravating position or a movement for those with that lateral hip pain. So let's have a look at a tempo squat. I'm going to start with my feet here, but we're going to play around with how wide you have your feet. And I'm going nice and slow on the way down to a depth that I feel comfortable, and slow on the way up. So slowing down the movement can often make it more tolerable and manageable for you. So I recommend doing up to 15 repetitions of this. We want to keep the reps nice and high. Now, something we can play around with is the width of your feet, your stance for this exercise. And that's going to vary in terms of the individual of what feels comfortable. So you might find taking a really wide stance like this much more comfortable on your hip. And I'll show you that from side on with a nice wide stance, nice and slow. Or conversely, you might find having a narrower stance. So right now my feet are just below my hips. This might be a more tolerable position for you. It's really about playing around with it and finding what works for you. Now, if the squat is not tolerable at this point in time, you can do a sit to stand from a chair. So exactly the same, we're moving nice and slowly on the way up and the way down. And if you have a low chair, or if you find getting out of the chair is still painful on the side of your hip, you can add a cushion, and by increasing the height of the chair, that is going to make the movement easier for you to perform. So there's a few ways that you can build towards doing a squat by really slowing it down, and that's really going to help you in your everyday life, because there's so many instances where you have to get down in that squatting position. Give it a try.
The glute medius muscle on the side of your hip performs hip abduction, which means taking your leg away from your body. So that's what we're going to target with the standing hip abduction exercise. You're going to hold onto a piece of furniture, standing up straight, and all you're going to do is, with control, bring your leg out away from your body nice and slowly like so. That really isolates those muscles on the side of your hip. Now, I'm going to give you a couple of tips to help you get the most out of this exercise. The first, keep your toe pointing directly forwards like this. That really keeps the load on the outside of your hip. It's tempting to turn your toe out to the side, but that shifts some of the load to your front of your hip. We really want to challenge that glute med muscle. Tip number 2, keep that foot in the air the whole duration of the movement. So bring it out and bring it back in. And notice I don't put it back down. That gives my muscles a bit of a break, and we want to really challenge them. So if you're doing 10 to 15 repetitions of this as a starting point and it's too easy, you can make it more challenging by adding a pause to the movement. So you can bring it out and hold 2, 3 and back down, and hold 2, 3. And that's really adding some tension to that glute med muscle. And when you give this one a go, what you'll notice almost immediately is that these muscles on the side of the stance leg are working almost as hard, if not harder, than the muscles that are lifting this leg out to the side. So it's a great stimulus for the muscles on the side of your hip on both. So give that one a go. That's the standing hip abduction. Start with 10 to 15 repetitions, and to make it harder, don't forget, add that little pause in.
Okay, let's have a look at our fourth and final exercise, the side plank. Now, you might think of a plank as more of an abdominal exercise. However, when we're on our side, it really targets the muscles in the side of our hip. So I'll show you what I mean. It's good to have a cushion or a folded towel for this to put underneath your knees. It just makes it a little bit more comfortable. So I'm going to put my knees like that, and I'm going to go on my forearm and lift up my hips like that. So I'm trying to keep my body nice and straight, and I'm really feeling this in my bottom hip. The muscles on the side of my hip abductors, they're having to work really hard to keep me in this position. So it's a great way to build strength and tolerance in these muscles. Now, I like to recommend holding this position for 10 seconds and seeing if you can build up that duration. Now, if you find this a bit challenging, actually doing this exercise on the floor, you can do it on something like a chair. So I'm actually going to put my forearm on this and still using something underneath my knees, something nice and sturdy. I'm going to lean this way, and by increasing the height of my upper body, I'm feeling less load through the hip. However, it can be a good starting point in terms of building up that hip tolerance. So there you have the side plank. Give it a go. So what do we want you to take away from this video? Well, first of all, anatomical structures are only part of the story when it comes to your lateral hip pain.
A sudden increase in the load that you're putting through your hip can be a massive factor when it comes to your lateral hip pain. So try scaling back some of those activities.
Once your symptoms have settled, you can slowly build up your activity levels with really small increases.
And of course, try some of those exercises that we showed you to build up some strength and tolerance around your hip.
Speaking of hip pain, if you'd like to see us do a video of hip osteoarthritis, comment yes below. Thanks for watching.